comments, as reported, are taken out of context, separated from the many other discussions that would have occurred in the days before and after, as part of ongoing discussions to ensure that my advice to the Premier and to the Minister of Health is grounded in evidence and considers every facet of potential discussions with elected leaders. This process has been violated. These meetings should be a safe space where public servants have candid and ongoing conversations and debates. This safety and trust are now broken. I have been clear that my role as Chief Medical Officer of Health is set out in legislation. My role is to provide the best advice possible to elected officials on how to protect the public health of all Albertans. I take that responsibility seriously. I care deeply about the health of Albertans. It remains my hope that Albertans understand that and respect that every conversation I have puts their health and a holistic consideration of all aspects of their health first. There are no risk-free options with COVID-19. This pandemic has challenged us all and required a wide range of complex decisions, all of which have strengths and weaknesses. I continually provide recommendations to government, often outlining a range of policy alternatives which they then debate. Once elected officials make a decision, my team works to implement the policy direction that the government has chosen, working with public health officials, Alberta Health Services, and the rest of the public service to do everything possible to limit the spread of COVID-19. I have always felt that my ideas are respectfully considered. I have always had respectful discussions between public servants and with elected officials. I do not dictate every detail of each policy decision, and I should not. I was not elected by Albertans. The final decisions are up to elected officials who were chosen by Albertans. This is how democracy works. I know that there are many views about how we should proceed. However, we are becoming divided when we most need to engage in respectful dialogue. We need to do this together for the health of all Albertans. We must listen to and consider the thoughts of others who do not agree with us. All of us want the same thing: to protect the health of Albertans, to protect our health system, and to minimize the impact this pandemic is having on everyone's lives. I have often said we are all in this together because I believe it, and it remains as true today as ever. Turning to today's numbers, over the last 24 hours, we have identified 1,077 new cases of COVID-19 in Alberta, and about 15,900 tests were completed yesterday. This means that our provincial positivity rate currently sits at about 7%, and we have 14,052 active cases. There are 383 people in hospital. Of those, 84 are in ICU. Sadly, I must also report 10 new deaths that were reported to us over the past 24 hours. My condolences go out to the loved ones and friends who are mourning these lives lost. Turning to schools, there are currently active alerts or outbreaks in 359 schools, about 15% of all schools in Alberta. Currently, these schools have a combined total of 1,288 active cases. This number includes 190 schools with outbreaks, including 84 currently on the watch list. We continue to review the emerging evidence around COVID-19 and the best way to protect Albertans. We have posted new fact sheets online today, summarizing some of the recent literature on ways that COVID-19 is transmitted, masks, and aerosol transmission, and what this means for you. There has been interest in aerosol transmission, so let me take a moment to talk about that. The emerging evidence shows what we have said for some time. The dominant mode of transmission is via respiratory droplets that happen when people are in close, unprotected contact within 2 meters. Since early in the pandemic, we've known that aerosol-generating medical procedures have the potential to cause transmission of the virus through the air at longer distances. These procedures occur almost exclusively in medical settings and can be managed through additional infection prevention and control measures. Alberta Health has also been monitoring evidence and outbreaks since the onset of the COVID-19 pandemic. Evidence currently shows that in specific circumstances, there can be increased risk of the virus traveling through the air across greater distances. This is usually seen when individuals are together for prolonged periods of time, especially when doing activities like exercise that makes them expel small particles at greater volumes and distances. I want to be clear that the current evidence indicates COVID does not spread through the same kind of long distances and long times that measles does. And the core recommendations that have been in place since the spring remain true. Stay home when sick, wash or sanitize your hands regularly, keep distanced, and wear masks indoors when around those outside your household. Personal protective equipment guidance remains the same, and the current evidence does not indicate a need to change that. There are, however, steps that businesses and others can take, such as paying attention to ventilation of indoor spaces, and we have posted an evidence-based one-pager on our website to help.
All right, so that is the latest from Alberta on there. She did start off talking about a story from the CBC in Alberta where secret conversations between the Premier and health officials had been leaked and there had been disagreement. And clearly Dr. Hinshaw saying, I'm not elected. They make the decisions, not me. She had a quiet fury about that. That was kind of interesting. But of course, the cases are spiking there. And there's lots of criticism about Alberta just not taking a lot of measures or full lockdown measures, but these kind of half measures that have not really bent the curve there.